So how do you run a code? Leadership affects the quality of care and teamwork during a code. Becoming a good team leader requires practice, just like everything else in medicine, and this is your opportunity to learn leadership skills by seeing them in action. So, you've heard the code blue call announced and you're responding to the scene. Based on available evidence, there are 3 main goals you must achieve as a code team leader in order to maximize the chances of patient survival. Great compressions. Compressions should be deep and fast at a rate of at least 100 beats per minute, at least 2 inches deep, while allowing full recoil between compressions. Early rhythm identification and defibrillation. Initial defibrillation should occur within 3 minutes of a recognized code event. Building an expert team. We'll talk more about this. If you are able to do these 3 things, you will have the best chance of saving the patient's life. In order for you to start building an expert team, first they need to know who you are.
Hey guys, I'm the operations nurse. I'm here to help out.
Hi, I'm Sarah. I'm the Art Medicine R3.
Oh great, I'm Kim, I'm the operations nurse.
Is anybody the code leader? I'm going to be that.
Oh, great.
Let's talk a bit about how Sarah introduced herself. As obvious as this step may seem, we know code team leaders often forget it, and in the midst of a resuscitation, leaders are often hard to identify, especially for providers who arrive partway through the code. We also know that delays in forming the code team are associated with worse outcomes. Forming a team in a matter of seconds when you don't even know anyone's name isn't easy. Start by making sure everyone knows who you are. Notice how Sarah and Kim are standing at the foot of the bed, have stated their names and level of training, and identified their roles in a loud, clear voice. In addition, Sarah is holding the ACLS Code Team Leader card. We'll talk more about this laminated card in a few moments. First, let's discuss Kim's role. The operations nurse is a leadership role that has always existed on the most effective code teams but had not been formally named. At UWMC, this role is filled by a stat nurse, and at HMC, it's an MC-ICU nurse. The operations nurse helps direct and organize the team. They bring years of experience with codes and have previously worked with many of the non-physician team members. Apart from collaborating with the code team leader, operations nurses also assign roles to other providers and monitor their tasks, especially the quality of compressions and how the recorder is doing. They also help maintain situational awareness. We'll talk more about this in a few moments. So what's this code team leader going to do next? Remember those 3 goals? Great compressions, early rhythm identification and defibrillation, and building an expert team.
Okay, it's been 2 minutes. Stop compressions. We're going to check a pulse and a rhythm.
Blood gas.
Gas lab.
Blood gas?
No pulse. All right, let's resume compressions. Okay, so no carotid or femoral pulse. The patient's in B-track.
How did she do this? Certainly part of it is that her team was working well even before she arrived, but she's showing great leadership skills. She thought aloud, the team knows exactly who's in charge, they're working efficiently, and they know what the next steps are. Everyone has a shared mental model. She also gave feedback while she assessed the situation. The communication loop was then closed using a checkback. In just a few seconds, you've already seen several TeamSteps tools. Using TeamSteps terminology facilitates interdisciplinary communication about teamwork and leadership competencies by using a common language.
Stop compressions and stand clear for a shock.
Clear. I'm clear, you're clear, everybody clear? Delivering shock.
All right, let's resume compressions. Nice work, everyone.
Great job on those compressions. You know what, with the next cycle, I'd like to switch out compressors.
To most efficiently and effectively work with your team, you must be medically competent prior to entering the room. It's no time to learn ACLS when you're trying to run a real code. That being said, we know that stressful situations and multitasking make it difficult to remember details. This is where the ACLS card comes in. The ACLS card includes the basic algorithms and the list of H's and T's for the etiologies of PEA arrest. Some of you are probably thinking, that's silly, I don't need to hold some card with the things I already know, I'm trying to run a code. It's this sort of overconfidence that often leads to poor outcomes. Instead, use the card as a checklist. This allows you to manage the rest of the code while making sure that simple but critical steps are not overlooked. Let's quickly review the code team roles, since knowing them is a prerequisite to being able to properly delegate tasks. Each of the roles displayed here are explained in depth in the Code Team Member e-learning module. The positioning of each provider is important and has been specifically designed so that the team can work most efficiently. The importance of properly delegating tasks and the leader not doing anything themselves.
Let's continue compressions for 2 more minutes. Let's give 1 milligram of epinephrine.
Epinephrine, 1 milligram.
You know, I think that we've only got some prophylaxis in place and we're gonna need some more, so I'd like to place an intraosseous catheter. Dr. Sheridan?
Yes, this is Dr. Anderson. Mark Fetter, your patient, in 8006 has coded.
Okay, we have an IO in place in the left leg.
Okay, give me 1 milligram of epi.
Hey, it doesn't look like we have a running IV fluid.
Oh, you're right. You know what? Can we get another half liter of normal saline up?
I'll get that home.
Thanks.
Can you give them the 300 milligrams of IV amiodarone pharmacy?
Amiodarone, 300 milligrams. Should that saline be on a pressure bag?
Oh, absolutely. Let's put that on the pressure bag. Thank you.
Cross-monitoring is when team members watch each other's backs and intervene collaboratively, helping everyone work more efficiently. In this situation, the defib nurse noticed the lack of IV fluid and the patient nurse suggested a pressure bag. This cross-monitoring maintains situational awareness while the operations nurse finished putting in the IO catheter. Code team responders are highly skilled in their area of practice. Most often, what prevents a code team from being effective is their organization and communication. This is why skilled leadership is critical during codes. Recognize that we have biological limits on our ability to multitask. To avoid cognitive overload, code leaders should not be performing hands-on tasks, such as doing an ABG, performing chest compressions, or charging the defibrillator. These tasks should be delegated to other team members unless they're unavailable and the task is critical. By having each role in a predetermined position, the operations nurse and code team leader can delegate tasks more easily. The 2-minute cycle of CPR, followed by a brief 10-second pause for pulse and rhythm checks, is an opportunity to create and maintain the shared mental model. It's also where you'll see team steps in full effect. Watch as the code team leader employs these tools.
Can we intubate the patient now?
You know, I think bagging's going okay. I'd want to maximize compressions.
Okay, I'll let you know if the bag mask ventilation gets difficult.
Okay.
It's been 2 minutes since the last pulse check.
Check over them.
Pulse is present. Heart rate's 122.
Maintaining situational awareness is a key competency for any team member. Periodically step back and make sure you're focusing on the big picture. Sometimes when the situation is really stressful and chaotic, this can be challenging. One mnemonic you can use to help remember how to do this is STEP. Assess the status of the patient, the team, the environment, progress towards the goal.
So I'd like to start him on a pressor, and given his tachycardia and recent arrhythmia, I'd like to start him on phenylephrine. Does that sound okay?
Yeah, I think that's good.
Okay. All right, let's start that phenylephrine, please.
Okay, getting phenylephrine.
Sarah, you're doing a great job here. What do you think about the coda?
Phenylephrine? Okay.
Well, I don't know. It looked like a VT arrest to me. The patient has coronary artery disease and the heart disease. He's predisposed to VT. Maybe Mickey should talk to cardiology.
Yeah, it's reasonable. I think we ought to eyeball the rhythm strips again, though, especially.
The operations nurse and code team leader should work together to run the code. Should they disagree, ultimate responsibility and authority is carried by the code team leader. Collaborative solutions should always be sought, and their relationship should be based on mutual respect. One of the best ways to collaborate is around task prioritization. It can be challenging to determine which tasks need to happen most urgently and which can wait, and the operations nurse's experience can be especially helpful. Despite our best efforts to prepare, sometimes we don't know what to do. At other times, we may think we have the right answer, but we fail to consider alternatives. This is called fixation error. It's important to know your limitations, ask for help, and remember to consider a full differential diagnosis. While you need to be learning how to run codes, we must balance this with patient safety and quality of care. The supervising MD should allow graduated autonomy, being present but not involved unless necessary to ensure safety.
You know, I reviewed the meds and it looks like you got 10 milligrams of Haldol in the last 24 hours.
I know his primary team checked an ECG this morning and the QTC was long on that one, but they said it was okay to keep giving the medication.
Okay, thanks. Can we get a 12-lead EKG?
Yeah, I think that's a good idea. We'll review that. Assuming he's still perfusing okay, let's get him to the unit as soon as they're ready. And then, if you don't mind, team, let's circle back here and debrief. Great job, everybody.
So to summarize, you have 3 main goals as a code team leader. Great compressions, early defibrillation, build an expert team. To do this, you need to prepare, know ACLS, and the code team roles. Build your team. Establish control and use Team Steps tools to create a shared mental model. Focus on the big picture. Avoid performing hands-on tasks. Make sure that you have situational awareness and do cross-monitoring. Work with your team. Request input from others, collaborate, do task prioritization, and delegate. Recognize your limitations. Avoid fixation error and ask for help when you need it. Practice. Deliberate practice is what is unique about experts. Use the mock codes to refine your leadership skills and remember to debrief so as to capitalize on these infrequent but important learning opportunities.